Welcome everyone. My name is Dr. David McDuff. I'm clinical professor of psychiatry at the University of Maryland School of Medicine and an addiction psychiatrist at the Howard County Health Department. Today's video has two main purposes. One is to offer training and awareness about opioids, opioid overdose. So primarily we're talking about painkillers and heroin, and what's happened over the last 10 years with the great rise in the number of deaths from opioid overdose. So today you'll learn about what is an overdose, what causes it, how to reverse it, and also how to prevent it. So you can view this video just for your own information, to educate yourself, so it could hopefully educate others. Or you could view it with a mind to becoming a certificate holder that would allow you to be prescribed naloxone that you could use on a loved one, a family member, or even a friend. The presentation today has 6 segments, and we'll go through each of these, and feel free to pause at the end of each segment in the middle of a section. If you want to look more closely at a slide and read the content, that's fine too. This is part of the state of Maryland's overdose prevention program, and many states have actually adopted a more aggressive approach to try to stem this rising tide of overdose from heroin and painkillers. So these are the 6 sections. We'll first start with the scope of the problem, and I'll show you some trend graphs of what's happened over the last 10 years. Then we'll learn about what is an opioid, recognizing an overdose, then responding and reversing the overdose, then what are the rights and responsibilities if you do get granted a certificate, and then finally some tips for preventing overdose. So if you look at this slide, you'll see that over the last 10 years, the green line at the top, the sales of prescription pain medications, and we're talking mainly narcotic pain medications, have quadrupled. So there's a 4-fold increase. This is up to 2010. It's continued to rise through 11, 12, 13, and into this year. And you can see that the trend line for deaths very closely follows the rise in the number of prescriptions written. There are many reasons for this increase in number of prescriptions, but the worry is that when you write more prescriptions, they find their way to an at-risk population. And that at-risk population is much more likely to misuse or become addicted to the pain medicine. And this is one of the explainers of the increased number of deaths that have been seen. They've also increased by 400% over the last 10 years, up to levels that we associate with other serious causes of injuries like motor vehicle accidents, or even suicides and homicides. You might wonder, are these overdoses intentional? Someone trying to take their life, but what this slide demonstrates is the vast majority of them are unintentional. So the individual is using pain pills or using heroin for the effect that they like, and they overshoot the mark. They take too many pain pills in too short a period of time, or they inject too much heroin, or heroin that has a high purity level that's unknown to them because you can't determine that. So the take-home point here is that most of the deaths from overdose are not intended for that outcome by the individual. So this just demonstrates what's happened over a 20-plus year period, that deaths from motor vehicle accidents, that's the number of deaths on the left-hand side of the slide, has been steadily falling, and this is due to the many safety measures that have been put in place by cars. but the poisonings, the overdose deaths have risen, and now death by overdose is more common in America than death by motor vehicle accident. And if you think about that for a minute, it's rather astounding that that could be true. This just shows, what specific substances are part of that overdose picture. And you see that the dominant one is the red line at the top, which are the opioids. So these are the prescription pain medications. This is national data. So down at the green, you'll see that there's a bit of a rise in the trend line with heroin. But depending on the state or the area of a state, that green line could be much more exaggerated. And what's happened with heroin is it's grown in popularity, and its use has shifted from urban centers out to suburban and even rural areas. And it's also contributed to the number of deaths from opioid overdose. This is a funny looking slide, but what it shows you is which counties in red write the most prescriptions. So what state jumps out at you? Clearly Florida has a dominance of red. In part that's because there are many, many pain clinics that have developed in Florida, a number of which have been shut down just because they were really places where individuals could go to get pills with the intent to misuse them or to maintain an addiction. You also see in the northwest area of the U.S., but look at the dominance of red in the middle of the United States, in West Virginia, Ohio, Tennessee, Kentucky. There are areas where there are rural, poor, high unemployment rates, and they've had difficulty with painkiller addiction for 15 years. So this just gives you a sense of where the number of prescriptions have been written, and this will lead you right to the likelihood of someone being at risk for an overdose. This is 2008 information, but it does just show you which states in the dark purple have the highest rates of overdose. So this is the number of persons who die in a year per 100,000 population. So that's a typical way of citing a rate. You'll see that Maryland's rate is in the higher end of the third band there. It's a little tough to see, but all of these rates have risen to a very worrisome level and now are even higher than what this slide demonstrates. This shows you a breakdown of what's happened over a 7-year period with deaths from prescription medication versus heroin, the two main categories of opioids. And you see that heroin has risen statewide in the last 2 years. And what seems to happen is that as individuals get addicted to painkillers and they need more and more painkillers, it becomes far too expensive for them to maintain the use, so they'll shift from painkiller use to maintain an addiction over to heroin. Heroin is cheaper and it will relieve withdrawal symptoms that develop, and so it's one of the reasons you're seeing a rise in the use of heroin. There's also just a rise in the use of heroin in and of itself, and suburban counties have been worried about this for more than 10 years as the number of deaths from overdose in central Maryland and in the western and eastern parts of our state have risen over this same 7-year period. So what are some of the key points to this section? So as the sales of pain medications have risen, so too has one of the negative consequences of more painkillers being out in our neighborhoods and communities. There's a rise that worries us about unintentional overdose. Heroin use has increased and has left the urban center and gone out to suburban counties and even into rural areas in the eastern and western part of our state and other states. And then nationally, deaths from overdose is more common now than motor vehicle accidents. I never thought I would see that in my lifetime. And interestingly enough, the United States is only 5% of the world's population, but we consume 80% of the narcotic pain medicines. That should really make you pause and think and wonder. Now, you could say the rest of the world is under-medicating or not treating legitimate pain syndromes, but I think we may have had the pendulum swing a bit too far in our country, where it's simply too automatic to get a prescription from a doctor or a dentist, and then when it makes its way into an at-risk population, you have the perfect storm for the development of progressive addiction and risk of overdose.